Okay, good afternoon, everyone. Thank you for coming. We are about to start. This session, as I said, is around community-led monitoring. My name is Solange Batiste. I'm the Executive Director at ITPC Global, the International Treatment Preparedness Coalition. And we are here to understand why CLM, or community-led monitoring, is a good tool to support the HIV response in the region. We have some esteemed colleagues with us. And as we go along, I will introduce them. And we should be aiming to end on time if all goes well. So we have a range of presentations and time for a sort of a panel discussion with some questions from the audience. So welcome, and in terms of an overview, we want to really talk about and reinforce the key principles of community-led monitoring with a focus on community leadership. We will review the core principles of CLM and hear from communities, government, and technical assistance providers on their perspective of the issues learned from real-life field implementation of CLM. How many of you here have been involved in CLM by show of hands? Have you either implemented or provided TA? How many of you CLM is new to you and you're interested in it? Yeah, so a few of us. So we'll be happy to learn from the audience as well what your experience has been. And we'll have a chance to also review some of the resources that have been made available through the work done over the course of a few years. Okay, so I'm going to hand over now to Christophoros Maloris, Senior Regional Advisor at UNAIDS, around the principles and the practice of CLM. See, I always call Chris, not Christophoros. So I'm saying. I don't know who's speaking, but thank you for saying something. So Chris does not have slides, in case the people at the back are wondering. So he's just going to speak to something else. So over to you, Chris. Thank you. I believe we're hearing the French translation, so perhaps we want to check on that.
Yeah,
thanks.
Yeah, I had some slides, but if it's a technical issue, I can just speak on to them. They're not, it's just words, it's okay. Maybe this is a bit more easier and more animated. So hi everyone, my name is Chris Maloris. I work at the UNAIDS regional office in Johannesburg for Eastern Southern Africa. And part of what I do is also community engagement and includes community-led monitoring, which is a very important part of the HIV response. And it's great to see that it's starting to be scaled up in the region, but it's definitely not where we need it to be. We need to make sure that we really move towards resilient, sustainable, community-led monitoring programs. So what I was going to do today, just to start us off, is go a little bit on definitions. Because for us to understand and support community-led monitoring, we need to understand what do we mean by communities, what do we mean by community-led organizations, what do we mean by community-led responses, and part of that is community-led monitoring. So what do we mean by communities? Well, communities are diverse and dynamic, and one person may be part of more than one community. Communities are formed by people who are connected to each other in distinct and varied ways. Communities are people who health systems are trying to reach and whose health they aim to improve. They are people who are particularly affected by a given health problem, in this case, HIV, people who share specific characteristics or vulnerabilities, such as due to their gender, identity, geography, behavior, ethnicity, religion, culture, age, and I would say profession for sex workers as well. There are groups that represent these people. So we need to be clear what we mean by communities. And what we mean by community-led organizations, we make a distinction between community-led organizations and community-based organizations. Not all community-based organizations are community-led. Community-led organizations, groups, and networks, whether formally or informally organized, are entities for which the majority of governance, leadership, staff, spokespeople, membership, and volunteers reflect the experiences, perspectives, and voices of their constituencies, and who have transparent mechanisms of accountability to their constituencies. Community-led organizations, groups, and networks are self-determining and autonomous and not influenced by government, commercial, or donor agencies. Not all community-based organizations are community-led, and we hear that often and often again in this session. The biggest challenge we're facing with community-led monitoring is to really truly let communities lead in the efforts. So community-led responses, now that we have a definition of what community-led organizations, community-led responses are those actions and strategies that seek to improve the health and human rights of their constituencies that are specifically informed and implemented by and for communities themselves and the organizations, groups, and networks that represent them. So in this particular case, we're talking about PNHRV groups, we're talking about sex worker groups, gay men and other men who have sex with men groups, people who inject drugs groups, transgender people groups, migrant population groups, people with disability groups, those that the services are trying to reach. 1 minute. So community-led responses include advocacy, participation, accountability, service delivery, but also a gathering of evidence. That includes community-led monitoring. And so community-led monitoring for us is an accountability mechanism for national HIV responses led and implemented by local community-led organizations of people living with HIV, networks of key populations, other affected groups, and so on. And it uses a structured platform and rigorously trained peer monitors to systematically and routinely collect and analyze qualitative and quantitative data on HIV service delivery, including data from people in community settings who might not be accessing healthcare and established. So what needs to be measured, needs to be defined by communities. The way that it is to be measured has to be defined by communities. The ones measuring what needs to be measured is our community members. Then community needs to also lead the evidence analysis and the advocacy around the use of the data. All of that cycle needs to be supported so that it's really truly community-led. And it can provide evidence on access to services, stigma and discrimination, experiences with prevention and sexual and reproductive rights. It depends on the community. I'll stop there and then we can hear some real examples. Thank you.
Thank you, Chris. That was very helpful in getting an overview of the key principles and what happens in the practice. You know, most of you, you're asked to moderate a session, and you're asked to moderate a session because you have some view on the topic. But your job is really to manage time. So sorry about having to cut you off a little short, but we do need to finish on time, and I want to move to be able to hear the perspectives from our 3 speakers, and then we can then have a bit of a discussion. So I just move it along, and then we can come circle back at some of those key points. But Butho is from the Treatment Action Campaign in South Africa. I think the slides are currently up. So Butho, you have 4 minutes. You can speak to us about what you like. Thanks.
Thank you, Comrade. So I'll be asking if you can just turn the slides over because I can't do it myself. So please can you go to slide number 3, please. So while that's happening, my name is Nobuto Nebubofu. I work for the Treatment Action Campaign. We are the ones that administer a project called Richite, 3, not 4, sorry. And the Richite project is called Richite because it's a vendor for saving our lives. And it is a coalition, consortium of 5 different organizations that are PLHIV sector organizations in South Africa, plus 3 different partners. So you can see at the bottom, it's the Treatment Action Campaign, Sonarela Plus, Positive Women's Network, with Positive Action Campaign, and the National Association of People Living with HIV or AIDS. So, and then we also have Health Gap, AMFA, and O'Neill Institute. It was established in 2019, and it was done by all the organizations that are working in the SANAC PLHIV sector in the country. We monitor over 400 facilities in 8 different provinces. That's in 29 different districts in the country. We have an MOU with government so that we can do this. A lot of the time people think that we are always in contestation with the state but that's not necessarily the case all the time. We're working towards the same goals, and we use different methods to do that. We're not a research project. I think a lot of the time people assume that we are, and we're not. And the objective of the Rechitsa project is to improve the quality of HIV and TB service delivery in the country. Next slide, please. So just a quick note about the model that we use. The model that we use entails 6 different aspects. The first one is gathering evidence, and then we analyze data, and then we generate solutions, and then we engage duty bearers, and then we monitor the implementation. If there's no change, then we advocate for change through the multiple organizations that are part of it. So next slide. Just to speak about the issues that we would like that we espouse as a project. We are fiercely independent. I think it's very important that we say that. Rechitsa is community-led and community-owned. So the community is the one at the focal point every time when we're engaging. We're collaborative in nature. I think we've seen from already the number of organizations that are part of Rechitsa, and we collaborate beyond just the 8 organizations that are part of the project. We always were staffed by affected communities who use the services, so people who are public healthcare users. When we do KP services, it's the KP comrades themselves who are monitoring. So sex workers are monitoring sex work issues. We've got trans people monitoring people who use drugs. We have gay, bisexual, and men who have sex with men. We have people who are living with HIV who are also engaged in monitoring. So it's very important for us that we use the principle of what we call FUBU, which is for us, by us. And we want to be fully funded and action-oriented. Next slide, please. Just sites of struggle. As an organization, we are involved in many things. One is community accountability meeting, where where communities speak to their issues in front of duty bearers. We have Operation Kutuma meetings, which are meetings that are held with the state. Health Report does the same thing. We engage PEPFAR. We engage AIDS councils, clinics, clinic committees and hospital boards, and DCTs. That's the way we try and ensure that we ensure change. Next slide. So this is just to highlight the change that has been, the impact that Rechitsa has made. In 2021, we've seen an increase in the number of staff at clinics, less waiting time of 33%. We've seen an increase in PLHIVs being told about that they can refuse index testing, for instance. In 2022, we've seen a reduction in waiting time. We've seen an increase of reports of enough staff at clinics, and this is through active engagement that we have constantly with duty bearers at all levels, just to say. Just last, next slide, I'm finishing. Just to say thank you. This was really quick and dirty. You can take a look at our website. You can take a look at our various platforms in order to be able to see more. And then the last slide, I just want to leave with this until the next one, which is the last slide, please. This is a quote from Winnie Byanyima, who speaks about the importance of communities being in the center. So I'll just leave it there for a while. Thank you.
Thank you. Thank you very much, Bruto. That was super helpful and insightful. For those of you who thought that community-led monitoring was a fluffy thing, it's not. There's actual data that is collected rigorously using scientific methods. You can see actual change over time, and these trends are reflected in the slides where you can see specific indicators with increases or changes, which is where the success is measured. So it'll be interesting now as we move, thanks again, Bruto, from an implementer to a government perspective. And I would like to invite Amara Levy, the Senior Technical Advisor, the National AIDS Secretariat in Sierra Leone, to present his perspective on community-led monitoring. Thanks. Over to you, 4 minutes.
Thanks, Solange. Thanks, colleagues, for having me this afternoon. I think we are having this conversation around community-led monitoring during a time when we have a theme that puts the focus on the center of communities and asking that communities should lead the HIV response. And we know that over the years, this is what we have been calling for and what we have been sharing, that communities lead the HIV response. And this comes in a space of in a space that has been traditionally held by governments to steward the HIV responses more generally and to provide coordination for the HIV response. So when we talk about communities leading, it is important that we engage the traditional systems that have always held the space of our governments around how we are navigating this space around this shift of power, that it is understood by our government so that there is political will to enable the voices of communities that we have not been able traditionally to serve. The impetus for community-led monitoring really comes within a space where we're saying we're trying to reach to communities that we have not been able to reach over time in this HIV response. And in everything that we have done, we believe that these communities are the ones that face the brunt of marginalization. And as privileged persons wearing our government hats, it becomes difficult for us to program to those specific needs of communities. So catalyzing political will of governments to create space for community-led monitoring is important, and that governments entrench community-led monitoring in their policies and national strategies such that when you are implementing it, do not run into hurdles. Everyone understand that this is the thrust of monitoring that we are embarking on in order to end AIDS. So ensuring that you embed this, that the CLM as a national strategy for your HIV response, and that political will is there. And creating within that strategy the robust programs that define some minimum standards for a responsive and accountable CLM mechanism. Again, ensuring that your governments establish platforms for CLM data dissemination, for collectivized strategizing, and also feedback by communities. So we have seen in a lot, particularly in Zimbabwe, for example, there are platforms that are created by either the National AIDS Council through a community-led. We have a community-led national steering committee that is cascaded to sub-national level, a provincial and a district level, that ensures that every CLM data that comes through is analyzed in those points. So the other things that they need to strengthen and optimize accountability mechanisms to respond to CLM at national level and sub-national levels, as I speak to, and that governments have the responsibilities to cascade and build the capacity of government employees or individuals working at facility level that are being monitored to understand what CLM is, so that they create and open up the facilities for CLM monitors to be able to come in and do the monitoring. One of the things that we have seen being reported in different countries is that there is a lot of red tape and a lot of challenges that are faced by communities as they try to access facilities for community-led monitoring. So the responsibility of governments in Zimbabwe, we have had a national high-level multi-stakeholder CLM in that we brought largely, the national and sub-national sub-national government structures, our provincial medical directors and their staff to really unpack what CLM is, and that there is buy-in towards that. The other issue before my time is out is ensuring that governments fund CLM as part of, broader monitoring strategies to end HIV, and that they entrench this within domestic financing mechanisms. So within Zimbabwe, as you know, we have a best practice of a national AIDS trust fund that is being leveraged to support community-led monitoring. We would want to see in future this kind of funding going to communities that are the most marginalized, that have not had the privilege of access to these fundings. Currently, a lot of funding within CLM is coming through Global Fund and PEPFAR and other foundations and philanthropies. For sustainability, it is important that our governments collectively ensure that they do fund CLM. So we need again to remove the silos that we see. In a lot of space that you get to, you'll find that you have a PEPFAR CLM, you have a Global Fund CLM. It is important, I hate to use this word, harmonize, because it means different things to different individuals. We've tried using institutionalizing CLM. It feels like governments are taking over the leadership of CLM. We appreciate that the role of government more broadly is to create a conducive environment for communities to be able to implement community-led solutions without much hurdles. And the last bit that I would possibly want to share is for governments to listen to communities, to action, accountability, and to shift power. It's a difficult conversation that we currently have around what that shifting the power looks like and how we're going to do it. But I think it is a very important conversation if we are to get to an end of age to ensure that we have these difficult conversations about what that looks like. Thank you.
Thank you so very much. Interesting perspectives there from the government. Several questions should be popping to mind, so try to hold your questions. We'll have hopefully enough time to take some from the floor. Thank you very much, Amara, and I think you're right about the importance for governments to make space for that shift in power, so we'll see some of those experiences. It's a good segue now into hearing from a technical assistance provider who's probably navigating both sides, the government perspective as well as the community perspective, and providing some technical support. So we'll hear from Nike, the Director of International Policy and Advocacy at HealthGap. Over to you. 4 minutes. Thank you.
Thank you. And thank you for reminding us that government and space must be created for communities to express and for community to have their voice. We're seeing right now at ICASA that is not the case. So that shift of power is real. People are not allowed to protest. Things are being confiscated. It is intolerable in a place like a conference where the culture of conference is fostering the transparency and the centering of communities. And shame on ICASA right now for allowing this. So now I have to do business as usual, which pains me, but let's get a little bit of insight on support that is available. So I'll go in the next slide, please. Quickly about CLAW, we are a collective of many organizations coming together to create a decolonized South-South solidarity building. We even have a little bit of a reticence with the word technical assistance. We prefer power building and collaboration and learning platforms. Next slide, please. And we can jump to the one after, so I can go quick. So from the technical support, from where we stand, a few key lessons that we've been gathering from, all the work we've been jointly creating is that there's a need for CLM scale up because we see that CLM has an impact in addressing challenges, chronic challenges. And CLM is being proliferated. While the proliferation of CLM is happening, we see a real deep defunding of the support for CLM. And that is alarming because we don't want in a couple of years hearing, oh, communities can't do that. The support needs to be there to leverage and support community and to getting the skills, the support, the exchange that they need in order to succeed. The other thing we're seeing is challenges in implementation, a lot of challenges in independence, government and donors wanting to direct either indicators or methodology, how business is done, which is like totally counter the principles of really having powerful data that is fueling advocacy. Diminution and really ridiculous funding arrangements, micromanagement, funding not being done on time, and all of this is setting communities for failure, and we call on donors to do better. Next slide, please. Other key lessons, also the need for support and solidarity needs to be driven by communities. We can't have technical assistance shipped down to communities. Communities reach out to their allies and comrades and other experts and consultants, and that it's not shaped the other way around. Other things, we need to have both budget for implementation and budget for support. One without the other is a nonsense. Sometimes we see there's budget for like technical assistance and then there's no budget for implementation. What are people supposed to do after? And vice versa. So this irrational lack of meaningful architecturing of a system for communities needs to have integrity in it. Next slide. Other things, there are also shorter term support and long-term support. We realize in our practice that a good 2 years of commitment usually set up community for total independence where they barely even call us or, but also problem shooting or little things like helping with tweaking an indicator or a dashboard is also important. And these are some of the support that is available. Next slide. So now, question of like challenges. I would say the most important thing is the Decolonize project. If we want communities to lead and shift the system of health, we need to give them the power. So it's a decolonize in many ways. Like technical assistant providers are not super expert that knows everything and that direct communities and tell them what to do. So is government, and so is like big organizations that shift themselves into communities. It will not work because it will not really provide the insight. These things have been done before. That's why we're doing this differently, because this is deficient. I would say questions of funding, which I've said before, and also the appetite for evaluation and impact, which is very problematic. Because in early stages, we need to trust communities in creating the impact and giving them the oxygen they need to create it. All right, next slide.
You have like 10 seconds.
All right, perfect. Next slide again, please. Just a couple of thoughts, particularly for the implementers, where I would say one major place where it's important to maybe have a little bit of support is in doing setup and governance, because once this base is grounded, there's a little bit less pressure to then try to like problem shoot. And during project implementation also, there's like, all types of like support available through, mentoring and South-South exchange. Last slide. So that's it. Importance of building global learning, more exchanging amongst practitioners, and research to show, broadcast is best practice. And tomorrow at 2:30, we will hold a session that will show different CLM implementers that are doing really amazing. So we invite you to come. I forgot where it is, but I'll tell you in a minute. Thank you so much.
Thank you. Thanks everyone. Thanks to all our panelists for their presentations and giving us a good overview from a community perspective, government perspective, and a power building perspective, what it is like. I'm sure from your perspective, in your respective countries, you have had varying experiences with CLM. Some of it must be awesome, Some of it can be challenging, so we just want to open up now for some questions. And I'm going to try to manage this time very well. So it's 1:35. I think we can give about 10 minutes, maximum 8 minutes, because we also want to show you a bit of resources, and then we need to wrap up before 1:50. So if you have a burning question, you can, I'm not sure if there are microphones that are roaming or how that will be managed. I'm not seeing an IT person stand up, so in the meantime, I'm going to ask a question. So when there is a way to get the questions from the audience, please let me know. Okay, here we go. Please, there's a question in the front here, my friend in the blue. And if you, let's start with 2 questions, just in the interest of time. Please introduce yourself, and if you have a question to us.
Thank you very much. My name is Dorothy Onyango. I'm a woman living with HIV from Kenya. I work for Women Fighting AIDS in Kenya, and we're also implementing CLM. I think my question is for you. Sorry, I forgot the name. I just wanted to find out what tool you are using for collecting data, especially for specifically for stigma. How do you measure stigma in the community? I think that is something that we've been grappling with, and probably if you can share with us the best way forward, we'll be happy. Otherwise, from the NAC, it's very interesting that now you're embracing the challenges that we have been having in the community, and especially with the health facilities, to get into the facilities and get that data. That is really great. Thank you.
Thank you very much. Do we have one more question? I'm trying to have geographic balance in the front versus the back. So maybe back, sorry, and I know you guys. Yes, we have one hand sort of in the middle. Perhaps then we have one more question towards the back, so we take 3 and then we can see where we are with time.
Good afternoon, I'm Ricardo Walters from the Positive Vibes Trust. I appreciate, Chris, your emphasis on principles for community-led monitoring that have now been agreed internationally: independence, locally led, non-duplication of national health information systems. In a presentation yesterday on a data and information ecosystem in Zimbabwe, an e-health system, a senior health Ministry of Health representative explained that unlike in other countries, Zimbabwe is opposite. Health information does not belong to the citizens, it belongs to the government. It belongs to the ministry. And the representative explained that over the next year, there will be a Data Information Act requiring that any actor, including communities who are using dashboards to do community-led monitoring, would be required to submit their data to the ministry. This seems to be a little bit in violation of international principles, and I'm curious if anyone on the panel has a response. Part B of the question is anyone responsible for protecting the integrity of these principles when citizens come into contestation with their governments who are applying a system that really is not what's been agreed to? Thanks.
Thank you very much. One last burning one towards the back, right? My right, that side. Okay, yes. It's a sea of people. I just see a hand. Yes.
Hi, good
Thank
afternoon. Good afternoon. I think community-led monitoring is really a fantastic demonstrated way of holding duty bearers accountable. There's also been a lot of discussion at this conference about the pediatric care and treatment gap. And I'm wondering if there's a way, or if there's suggestions from the panel here about how community-led monitoring can help to bring children along as we move forward. Thank you.
Excellent questions. Okay, so Buta, we'll start with you, then Chris, and then if anybody wants to answer pediatrics, I could also input. Thanks.
Thank you, Comrade. Comrade Dorothy, so we do electronic and paper-based surveys. We collect both quantitative and qualitative data. We do it through an app called ComCare, and then we have a dashboard which is open source where everyone can take a look at. Just to say that we engage both public healthcare users and workers, and we ask questions around staff friendliness For instance, when we're engaging with KPs, we're engaging with different HIV or people who use the healthcare system. And then that's how we are able to then come up with the data that we have. And interestingly enough, we found that about 12% of key populations aren't actually accessing healthcare because of issues about staff friendliness being a big problem. So that's something that we constantly work on, and we're trying to.
Thank you very much. And really linking that to the quality of service as experienced by recipients of care. So thanks very much for that. And so, Chris, you want to jump on that other question?
Yeah, and thank you, Ricardo, for raising it. I think it's really important. We're seeing closing of civic space for many reasons, not just around community-led monitoring and generation of evidence. We need to continue fighting for the space for civil society and democracy, and including on evidence generation and the use of data. So it's our job as UN, as donors, as development partners, to keep advocating for the need for community-led monitoring, the benefit of it, and take very seriously these risks that are in the future, like Zimbabwe. That would be a terrible consequence if we lose community-led monitoring. It's our job to keep fighting for it. It's public good, I think. And now on pediatric, I think we similarly difficult is how do we get, for example, evidence from around prisoners. When the community itself is not able, like children are not going to be able to collect data themselves, how do we then work, if it's not community-led precisely, how do we work within the community to ensure that that there is evidence around the population that is left behind? It's not an easy way around it. It might be community-based, but we need to find ways as communities around it so that evidence covers every population that's left behind.
Yes, thank you. And
Yes, to add to that for the pediatric, the model is also versatile, right? Like we've supported with putting in place an adolescent girl and young women CLM in Lesotho recently, where the indicators and the advocacy wins are designed by the girls themselves, and really addressing GBV, sexual health rights issues and prevention. In Haiti, they're doing CLM in prisons. Like using like old detainees, that are in mobile clinic for people that are just got incarcerated. I think there's like creativity that needs to be involved in a lot of like fluidity while abiding to the principles. I think something around make sure that the indicators and the measures are coming from the parent, through like clinics around, sorry, I speak French, so I'm translating. Clinic, where women give birth. I'm sure there are ways that we can get closer and make sure we don't go away from the principles.
thank you. And because of time, Amara, I will ask you to say if you want to respond, and then I'll ask you one last question across the board when you're up.
Yes, maybe just a minute to speak to what Ricardo was sharing. I wasn't in the conversation, but the session Ricardo referred to is a session that was sharing experiences out of a VMMC program that had leveraged an electronic based data capturing system that is being transitioned to the Ministry of Health and Childcare. It's a high quality improvement system that uses a DHIS2 based system with clinical data. So I think we need to sort of differentiate which data systems we're speaking to. What is being transitioned out of the data is handing over that program that was implemented by a partner for sustainability with the Ministry of Health and Childcare. And the conversation around the CLM data that is being collected by community is a conversation that we still need to lobby around with ministry around how that be elevated with the Ministry of Health and Childcare for accountability to see.
Thank you very much. May I ask the IT support please to put up the slides that show the resources, and you can just scroll through them while we try to wrap up the session. We only have 5 more minutes. The time for these sessions is just really too short. It's impossible to really have a substantive conversation here, but I would like to put a public service announcement that there's a session at 2:05 in Diamond, which is around whether we are ready for CLM to be part of national monitoring. And I think that's sort of a natural evolution of this discussion, whether or not we are ready for community-led monitoring to be part of a national monitoring system. And what are some of the things we need to make sure we guard as we think about that. So the slides are up, you can just scroll through them for me. Please move to the next slide. You had it on just now, you can just advance. Okay. Next slide. Okay, while that's waiting to be done, I will just ask everyone to give me one sentence from your perspective. So we have UNAIDS perspective, we have a community that's implementing CLM perspective, a government perspective, and technical support, power building perspective. What is your one piece of advice for stakeholders, whether it is you want to speak to the government, I'm not going to limit you. What one piece of advice you want to give? What's the one message people walking out this room, you want them to remember the one thing you said? Don't say 6 things, don't make a paragraph, 1 point. Okay, so take your time to think through that. I'm giving you a second to think through while I show the resources. So from ITPC, we have a CLM hub, which includes a CLM library and tries to be just a repository of all resources, not only ITPCs. The next slide is from IAS. You can put slide 2. I'm burning time so you guys can think of your one salient point. Right, so community-led monitoring resource repository plan for 2024 from the IAS. All these slides will be available on the ICASA website, so if you want to just remember that you get something from ITPC, you get something from IAS. The next slide is from HealthGap, I believe. Yes, HealthGap, so the CLAW consortium has many resources on the left, and then the last one is from Rachitse. So you can go to all those websites. If you go to the home website, you will be able to find that. Apologies that you're not able to see it as clearly as you should, but know that the resources are available. You can speak to any one of us, but we will all be walking to Diamond for the next conversation where you should follow. All right, so moving on now to the most salient point that we want to hear. Maybe I'll start with Naike to start first, so we can hear from you, and just move along, so quickly. Thanks.
Okay, communities are not the only one winning from CLM. The whole nation wins when the system gets strengthened. So please make space and valorize this initiative.
So for me, I actually wrote it down. Shifting power to facilitate robust CLM is a political decision. It is hard, but it is imperative.
And I'm speaking specifically to implementers to say, jealously guard your independence, but work with everyone in order to effect change.
If I would speak to the governments, I would say let communities lead, allow communities to engage in community monitoring the way that they see is necessary, the way they see is best to capture evidence, and to advocate with the evidence, use that evidence. It benefits all of us. Let communities lead.
Thank you very much. I think the one last thing I'd like to say is the importance of a national CLM strategy. Really to have an umbrella within which this fits, I think is critical to moving towards sustainability and resourcing to also support this work if we really have to think about beyond. And your question around the